an abdominal suture. Cover the wound with a sterile normal saline dressing. Notify the doctor. Prevent wound infection through strict asepsis. Administer antiemetics as prescribed to prevent vomiting and further strain on the abdominal incision. You have to administer antiemetics, which is anti-vomiting, if prescribed. This is to prevent vomiting and to further strain on the abdominal incision, because when you vomit, you tend to strain your abdominal incision. Instruct the client to splint the abdominal incision when coughing. This action assists in preventing or worsening these complications. Prepare the client for surgery as necessary. Client is ambulatory surgery. General criteria for client discharge. You can discharge the client if client is alert or oriented, client has voided, client has no respiratory distress, client is able to ambulate, swallow, and cough, client has minimal pain, client is not vomiting, client has minimal, if any, bleeding from the incision site, client has minimal bleeding from the incision site, serious draining. Client has a responsible adult available to drive the client home. The surgeon has signed a release form. Discharge teaching. Discharge teaching should be performed before the date of the scheduled procedure. Provide written instructions to the client and family regarding the specifics of care. Instruct the client and family about post-operative complications that can occur. Provide appropriate resources for home care support. Instruct the client not to drive, make important decisions, or sign any legal documents for 24 hours after receiving general anesthesia. 24 hours after receiving general anesthesia. Instruct the client to call the surgeon, ambulatory center, or emergency department if post-operative problem occurs. Instruct the client to keep follow-up appointments with the surgeon. Actions to take if evisceration occurs. Call for help. Ask the surgeon be notified and that needed supplies be brought to the client's room. Stay with the client. While waiting for supplies to arrive, place the client in a low Fowler's position with the knees bent. Cover the wound with a sterile normal saline dressing and keep the dressing moist. Take vital signs and monitor the client closely for signs of shock. Prepare the client for surgery as necessary. Document the occurrence, actions taken, and the client's response. Post-operative discharge teaching. Assess the client's readiness to learn, educational level, and desire to change or modify lifestyle. Assess the need for resources needed for home care. Demonstrate care of the incision and how to change the dressing. Instruct the client to cover the incision with plastic if showering is allowed. Be sure the client is provided with a 48-hour supply of dressing for home use. Instruct the client on the importance of returning to the health care provider's office for follow-up. Instruct the client that sutures usually are removed in the doctor's office 7 to 10 days after surgery. Sutures are removed 7 to 10 days after surgery. Inform the client that staples are removed 7 to 14 days after surgery and that the skin may slightly redden and when they are ready to be removed. Sterile dressing. Sterile strips may be applied to provide extra support after the sutures are removed. Instruct the client of the use of medication, their purpose, dosages, administration, and side effects. Instruct the client on diet and to drink 6 to 8 glasses of liquid a day. Instruct the client about activity levels and to resume normal activities gradually. Instruct the patient to avoid lifting for 6 weeks if a major surgical procedure was performed. Instruct the client with an abdominal incision not to lift anything weighing 10 pounds or more and not to engage in any activities that involve pushing or pulling. The patient usually can return to work in 6 to 8 weeks depending on the procedure and prescribed by the doctor. Instruct the client about the signs and symptoms of complication and when to call the doctor. Hypoactive bowel sounds heard in all four quadrants are a normal occurrence. Hypoactive bowel sounds heard in all four quadrants are normal occurrences. Prednisone is a corticosteroid. Prednisone is a corticosteroid. With prolonged use, corticosteroid cause adrenal atrophy, which reduces the ability of the body to withstand stress. When stress is severe, corticosteroids are essential to life. Before and during surgery, dosages may be increased temporarily. Ferrous sulfate is an oral iron preparation used to treat iron deficiency anemia. Cyclobenzaprine or Flexeril is a skeletal muscle relaxant. Conjugated estrogen, Premarin. Conjugated estrogen, Premarin, is an estrogen used for hormone replacement therapy in postmenopausal women. These last three medications may be withheld before surgery without undue effects on the client. The nurse places the client in a low Fowler's position and the client is kept quiet and instructed not to cough.